If you've been wondering, what do we do to help patients with vertigo? I'm going to go over one of the types of adjustments that we do here today so that you've got an idea or a clue. Once again, my name is Dr. Gregg Gerstin, and I help people to remove the blockages from their health so they can lead amazing, fantastic lives. Today, I've enlisted the help of one of our awesome team members, Eric. Eric has been helping out so much with helping people to transform their spines, and he's going to help us with this adjustment for today. If you guys appreciate Eric, go ahead and write down below and tell him thanks for participating, showing us what's going on. And we're going to see if he can wind up getting more love than Nicole did in our previous one. If you want to check out that video, go look up here and decide who you want to give your love to. Or just give it to them both because they're both amazing. So when someone's got difficulty with vertigo, one of the things that we always look to check is their jaw. Now, the adjustment, or the way that I like to check it, is by using some muscle test and straining the joint. So what I'm going to do is have Eric bring his arm up and out. We're going to test his deltoid muscle. So I'm going to have you hold that there. Since we know that it's strong and it works because I just tested and I couldn't move it, we're then going to have him move and test his jaw. So what I'm going to do is have you bite down as hard as you can. Don't let me move your arm. Open up as wide as you can. Don't let me move your arm. Jaw to one side. Don't let me move your arm. Jaw to the other side. Okay, so you may have noticed that last one, move your jaw to this side for me. Don't let me push you down. It gets weak and it moves. That indicates that when he moves his jaw in that way, there's a deficiency or problem within his jaw. What I'm going to do is some specific work on some unique muscles within his jaw to help them work better. We're then going to wind up gently adjusting it so that the information getting into the vestibular centers of his brain can be a bit more effective. Now, this is usually super tender and tight. And Eric, you want to let everyone know, is it tender?
Yes.
Yep. So we look to be very careful and do it limitedly. Next up, I'm going to use my arthrostim to help adjusting his jaw. And then, of course, afterwards, we're always going to double check to see what kind of change we created. So I'm going to have you bring your arm up and out. Don't let me push you down. Super. Can you move your jaw away from me? Don't let me move you. Rock solid. So our goal is for every patient to leave the office strong like that, connected, saying that the information from their brain gets down their spine. And right, Eric, help me out. His brain's right here. Not much interference. Goes down his spine to all the tissues, organs, and glands in the body, and that information comes all the way back up. If we've got blockages anywhere throughout your spine, it'll wind up distressing how those brain centers get information and cause you to have symptoms, one of which can be vertigo. If you've had problems with this, make sure to wind up sharing this with someone you know, or to share it with the people you care about. If you need help, go ahead and write down below. We've got a number of ways that we can wind up helping for you to get back to the way that you should. If you like videos like this, go ahead and subscribe to your channel. Once again, my name is Dr. Gregg with the Lyme Wellness Center, and I want to thank you for letting me be a part of your health.